Welcome back. We're joined now by Chris Christensen, who is a member of St. Peter's PFAC. Thanks for being on our show, Chris.
Bet.
So how long have you been with PFAC?
I've been there since the inception of the program.
Okay. So tell me a little bit about how you heard St. Pete's was looking for a PFAC member. How does that work?
I was in my doctor's office, and the nurse practitioner I was dealing with asked if she could put my name in for it. And I said, yeah, just remember, I won't keep my mouth shut. And so she put it in, and then they interviewed me, and next thing I knew, I was on it.
Perfect. So talk to me a little bit about that interview, process or the application process. How does that work?
Okay. At the time, they were working with a consultant, and it was recommended for some accreditation that they had to have a patient advisory council. So I met with Rhonda and also a gentleman from this, and they talked to me about it. I told them my background of working with groups, facilitating meetings, things of that nature, and I guess that's maybe why they wanted me.
Perfect. So we heard from Rhonda about the training that PFAC members receive earlier. Can you tell us about what the training was like from your perspective?
Well, I could joke and say they didn't train us at all, but
that
no, I wouldn't say that. Every meeting there's a portion of it devoted to informing us, training us. For example, this last time we talked about the information technology and how it's affecting healthcare. A couple meetings ago we had a new gentleman's in that's dealing with the finance. As you know, St. Peter's has had a history, at least by reputation, that you can't figure out your bills and you don't know what you're paying for. And they're addressing that. So every meeting there's a portion of it devoted to making us smarter, I guess you'd say.
That sounds great. Is there a personal reason or a specific reason why you wanted to become a PFAC member?
Yes, all indications are health is almost the #1 issue involving people anymore. And it's so important to us, and I just thought if I could contribute, maybe it's my turn to volunteer and contribute to it. Not necessarily be a critic, but get involved and maybe I can make a difference.
Absolutely. So can you tell us about your experience? What's it been like being on PFAC, and what's it like to be a PFAC member?
First of all, it's very interesting because you're learning past the surface. They're delving into things. They're very interested in what we have to say. As a matter of fact, sometimes they bring stuff to us and say, how would it affect you? And, it's like any large organization. They're good at acronyms. But if you're not a part of it, it can snow you. It can really snow you. So we can provide that to them. Take it from a patient perspective that doesn't have a background in, let's say, finance or something else. And then you read it and you go, what language is this in? It's not in English. So I think we've provided that to them. They've asked us to look at things. And then I personally have done it. I've talked to people and told them I'm on it, and they tell me of their concerns, and I'm able to take it back, and maybe not even in the meetings, but follow up so that some of those confusions, those angst that people have can get resolved.
That's excellent. Is there a specific project that you have worked on that you've really enjoyed? Of all of all of the issues you've discussed?
I'd have to say that one-on-one when people tell me their frustration, and Rhonda's excellent. When I mention it to her, she's on top of it. If it's something she doesn't deal with, she directs me to the right person. I found that very good. For example, the North Clinic, it's near my house. It was very frustrating going there. They have an urgent care. It was very frustrating getting in. You could stand in line for 30 minutes and nobody talked to you, and they'd have multiple lines that you go, if I'm in the wrong line, do I have to wait another 30 minutes? Those are some of the issues they're addressing, and I think you get that from a patient perspective.
Certainly.
And I think that's good to provide that to them.
Excellent. Have there been any challenges that you've identified, in participating and being on the committee?
Sure. Lack of patience on myself. Sometimes you want things to move faster.
Sure thing.
And we address some issues. Here's a term, like if you're not on the inside, but they called wayfaring. So several of us at a meeting were trying to guess what the word wayfaring was.
Okay.
Well, it's nothing but how do you get where you want to go in the clinic? So we researched various ways. Some places had, colored tape or on the walls or colored carpeting, and research found out that didn't work it so well. Really the best way we found is if you have an information desk and you either can print them a specific map for them or actually be escorted. And now at the clinic on Broadway, they have someone there that'll greet you, help you. That feels good. If you have somebody, especially they come from out of town.
Absolutely.
They're worried about getting a parking spot. How do you park? How do you do this? Then you get in there and then you don't know where to go.
Absolutely.
So that's been good.
So we just have time for one last question, and really from a patient perspective, what impact do you think PFAC is having on improving healthcare in this community, and just maybe a few sentences?
I think the big thing we're able to do is provide a good interface to the non-medical. Give them that perspective that maybe they don't think of, because they're in it every day.
Absolutely.
Working very hard.
That's excellent. Well, I want to thank you so much for being here today. It's been just a pleasure talking to you.
Thank you.
Excellent. I'd also like to thank Rhonda for sharing her experience as well. We appreciate your time, and thank you for tuning in this week. We hope you enjoyed our show, and we hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.